Welcome to the staff meeting at Marina Hills Animal Hospital. For our medical moment today, we're going to talk about diabetes. We do see diabetes in our companion pets, dogs and cats. The major way that you can pick a diabetic out of a crowd is they drink a lot of water. That's the hallmark. And some of these pets are so thirsty they wake up in the middle of the night because they have to drink and pee. Some of them will fall asleep with their face on their water dish. So often the diabetic is really thirsty. If you see an increase in your pet's water consumption, you don't have to wait until they are drinking an ocean and peeing a river. Any increase in water consumption is noteworthy, and it's worth a trip to the doctor to have it checked out. Diabetes can be diagnosed pretty straightforward with a few blood and urine tests. Diabetes mellitus refers to the situation where the body does not make enough insulin. You may know that bodies run on sugar. The sugar is circulated through the bloodstream, and all of the tissues in the body need sugar to do their work. That includes muscle and fat and eyeballs and nerves. And the way that these tissues access the energy they need is they use insulin. You can think of the bloodstream as the pantry where the food is stored, and insulin as the key to the pantry. And in the situation of diabetes mellitus, there isn't a key available, and so the pantry is full of sugar. There's lots of sugar in the bloodstream, but the tissues go hungry because they can't access that insulin, that sugar with the insulin. So, as a result, the body has to switch from metabolizing sugar to metabolizing other things, and specifically it turns to metabolizing fat and muscle. And so pets with diabetes, if it goes on long enough, they start to lose weight because they're chewing up their own body's resources beyond the sugar. One of the consequences of that, of metabolizing fat and muscle, is the production of something called ketones. And ketones are okay in low levels, but high levels of ketones can be toxic. And so a diabetic who lacks insulin has poor energy, poor stamina, and high blood sugar. The diabetic who's been that way for a while also has ketones that builds up in their bloodstream, and it can make them quite ill. And then they don't want to eat, and they have vomiting, they have diarrhea. So these pets, if we discover their diabetes in that situation, they often have to be in the hospital on IV fluids while we help them transition from metabolizing fat and protein back to metabolizing sugars. So the treatment for diabetes mellitus is to administer insulin. In the old days, if you were a diabetic and you needed insulin, you would hope that someone would walk on over to the local slaughterhouse and they would pick up the pancreas from a cow or a pig, and they would put it through a fancy meat grinder, and they would extract insulin from the pancreas of an animal. And then you, the human who has diabetes, would be injected with cow, beef, or pork insulin, and it saved your life. And that was better than dying of your diabetes. But it turns out that while the molecule insulin is very similar between different species, it is not exactly the same. And some clever folks many years ago now figured out how to trick bacteria into creating a perfect match of human insulin. So when we talk about insulin, we sometimes talk about the source. There is a thing called beef pork insulin. There is beef-based insulin, there's pork-based insulin, that's a natural product, and there is insulin called humulin, and humulin is actually a genetic replica of human insulin. No one ground up a person's pancreas to make it. It's been created in the laboratory by bacteria. When we talk about insulin, not only do we talk about the source, but we talk about the strength. It turns out that if you take a lot of something and you put it into a small volume, you have a high concentration. If you have a little bit and you put it into the same volume, you have a lower concentration. And whenever we talk about insulin, it's very important that you understand which concentration of insulin are we talking about. Commonly, insulin is available in what's called U100 strength or in what's called U40 strength. And of course, U100 has 100 units in each mil, whereas U40 has 40 units in each mil. This matters because small adjustments in the amount of insulin that we give makes big differences in our pets. And so it's very important whenever we talk about insulin that you're clear not only the source, the type, but also the concentration. Beyond that, insulin is also prepared in ways that affected duration of effect. There's an insulin called regular insulin that is very short acting. It lasts just for a few hours. And then there are longer acting insulins that are preferred for long-term case management. The result is that when we're using the long-term insulins, pets get an injection once or twice a day, whereas when we're using the short-acting insulins, they may need an injection every few hours. And there's certain indications for that when they're sick in the hospital. But long-term, that's not where we're going. Because insulin comes in different concentrations and insulin is administered based on its volume, right? You're going to draw something up into a syringe. It turns out that you need to be communicating clearly about the syringe because there are syringes that are calibrated for the different strengths of insulin. So whenever you talk about an insulin syringe, you have to talk about how many units per mil is that syringe anticipating. Why do I mention that? If I, as your veterinarian, prescribe you to give your pet insulin, and I prescribe to you a U100, a U40 insulin, and I give you U40 syringes, but your grandmother, who is a diabetic, gives you a box of syringes, and if that syringe is for U100 insulin, you can be misadministering the drug, right? If you don't have the syringe that matches the bottle, you can cause trouble. So it's important whenever we communicate that we get the details correct when we're talking about insulin. So once we have our diagnosis and we've decided that a pet is stable enough to go on to a long-term insulin, we will choose that insulin based on the species and the availability of the insulin, because insulins come and go from the marketplace. And then we will, based on what the book says, the formulary, choose a dosage for your pet. It is always an approximation of what we think is the right dose. Every individual responds differently to insulin. Some need more, some need less for a given body weight. And as a rule, we always want to give the right amount, but if we're going to make an error, we would like to give a little less, not too much. If we underdose insulin, you don't have quite the energy and stamina that you would if you were correctly dosed. But if we overdose insulin, the result is when you give the insulin, the tissues say thank you, yum, yum, yum. They go to the pantry, they pull all the sugar from the bloodstream, and the consequence is that there is no sugar in the bloodstream for the brain. The interesting part of this story is that the brain gets its sugar for free. The brain does not know anything about the insulin that circulates in the bloodstream. And so the brain just expects that sugar is going to be there. That's good and bad. The benefit is that you can be a diabetic and still be alive, because if your brain were to go hungry, you would just die. Okay, so you can have a functioning brain as a diabetic with high blood sugar. But when you have low blood sugar, because now you've given an excessive dose of insulin, now the brain has no sugar and it gets hungry. And the signs of low blood sugar, which would be correlated with high doses of insulin, would be sleepy, lethargy, weakness, seizure, coma, death. And we don't like that. And so when we're administering insulin, if in a family situation it's busy, it's hectic, there's mom, there's dad, there's a bottle of insulin, and we're not sure, did you give the insulin? Did you give the insulin? If there's ever a chance for error, we would rather not give the insulin at all than accidentally give it twice. If that makes sense? Yeah. So we choose an initial starting dose of insulin. We would ask our clients to administer it on a regular, consistent basis, keeping their pet's diet and exercise regular and consistent. And after they've been on that insulin for about a week to 10 days, we typically have them come back, and then we measure their blood sugar throughout the day. We're making a curve, measuring their blood sugar every few hours, because we want to know, is the insulin working? Is the type correct? Is it lasting the length of time we want it to? Is the dosage correct? Do we need to give more? Do we need to give less? And we make those adjustments. And typically with our pets, after 2 or 3 of these administer, check, correct cycles, we typically get into a pattern where their diabetes is pretty stable, and pets can live for years with their diabetes. What's frustrating is when pets have multiple illnesses. It turns out that stress affects your sugar metabolism. So pets who have physiologic stress from other illnesses makes it more difficult to control their diabetes. So a straight diabetic is generally manageable. The diabetic who has some other illness, whether it's an endocrine disorder like Cushing's disease or acromegalia, if they have a cancer at the same time, if they have some inflammatory condition that requires prednisone use, the management of the diabetes becomes much more demanding. Still can be managed, but it gets harder, it gets more difficult. One of the complications, of course, we watch for with a diabetic, we are constantly watching for signs of low blood sugar, and we want to be alert to that. We always give our clients instructions on how to rescue their pet from a low sugar event. But then also, we watch for urinary tract infection. Pets who have sugar in their urine are at increased risk for urinary tract infection. So part of the routine care for these guys is to check urinalysis regularly to make sure they haven't gotten a UTI. That could go up into their kidneys and cause any kind of trouble. That's the thumbnail of diabetes.